So this is the title of the talk. What it will provide is a bit of an overview for those of you who are thinking, actually, I might quite like to get involved in international volunteering activity, but I don't really know where to start. So a bit quick, there's lots of pictures, we're going to do a lot of talking, there might be some music a bit later on, and I hope that you really enjoy the presentation. So I'm going to introduce, following me, just talking to you about how to prepare, an introduction to, Stephen's already mentioned the Gulu Manchester Link. You're going to hear about 3 different types of volunteering activity. They are all based in Gulu in the north of Uganda, but I'm hoping it gives you a flavour of the different types of things that are available. So first things first, really it's all about timing. These things take time. You can't just decide, I'm going to go tomorrow. You really need, I think, to give yourselves about 6 months for all the preparation that's required. You might think about, where should I go? Quite often it's useful to talk to someone else who's been to the place that you might be considering going to, or that might influence your decision. It might be you've got family over there in a different country or a different setting. There's also your safety to consider, and you can have a look on the Foreign and Commonwealth website about the different varieties of countries, and they will give you a country overview, so you find out a little bit more about that place. When? It's not always a good time to go. Think about your career, your family, and think about what types of opportunity. The traditional ones are, you think of a nurse or a doctor, possibly going over doing some clinical work for 6 months and returning. But actually there's a much bigger spread of opportunities that are available. So it might be you go with an organisation for a long-term placement, or you come with the Gulu Man. It could be a shorter-term placement. It could be something that's actually UK-based, and people often don't realise that they can influence things that are happening globally and internationally just from the comfort of their own home. I've mentioned some of these before. It might be that your family or personal circumstances, when is the right time for you to do this? Sometimes it might be there isn't a right time, and it's just something you just have to go for. Think about finances. I'm going to mention that a little bit later in more detail, but these things are often quite a lot more expensive than people realise, and you think, actually, yeah, I'm going to be abroad, it's not going to cost very much, but as some of the other volunteers who are going to talk might tell you, yeah, definitely the costs add up. In terms of your career, I think this is particularly important for doctors on training schemes. There are some better points within your career to maybe undertake these opportunities where you have a natural break in training than others. And you should consider, have you got the relevant experience that's going to make you a useful member of a team in an overseas setting? Because if you're very inexperienced, think about what it is you're going to be able to offer. And are you going to be burdensome to, maybe there's one doctor in that health facility. If you're taking up all their time because you actually need that support yourself, then it may be that patients aren't being treated or managed. So think about whether that's appropriate. Do you need a bit more experience before you go? I mentioned earlier you could go with or without an organisation. There are organisations such as VSO, and ourselves, smaller ones that you could work with. And also do your homework, find out about the place, do as much as you can, talk to different people who've already had that experience. Think about if you need any pre-departure training. Quite often organisations may offer these, and they'll be in the topics of around your safety and security, your personal health, how that could be managed. It might be something, a different type of a skill, like a project management. It might be a clinical remit that you might need, so the tropical health diploma in, the diploma in tropical medicine and hygiene is a very well recognised diploma, and it might be useful for you to do that actually before you embark on an overseas experience. It might be that you want to brush up on your emergency or life support training, or you want to get a bigger overview about humanitarian work. So there are organisations that can provide that for you. So finances. Well, your options really are whether you do something paid or unpaid, and how you might fund it is a sort of GoFundMe. You could do some fundraising. There are lots of scholarships that are available that you can apply for. You can probably trawl about online to find these different organisations that you might approach and fill in an application form and see if you're successful. At MFT, we have something called the Dickinson Fund. So that actually supports overseas activity for MFT employees. So do have a look on the website. And I actually think the applications are due to come in for review, I think, by June, and I think they're reviewed again in November. So it's worth you exploring those options. You should always also think about when you return and your time out. Is it going to affect your pension? And is the organisation you're with, would they help with contributions to national insurance? Because you could be very excited about heading off and then realise there were actually some financial consequences or consequences to your benefits. So do get in touch with those organisations to find out how that would affect you. If you want to take time out, how do you go about it? Well, talk to your line manager or the Human Resources Department. The options might be a sort of leave of absence and an unpaid leave. It might be a career break that you take, or if it's for a shorter term trip, it could be a mixture really of study leave, annual leave, unpaid leave that enables you to undertake the activity you want to do. You might need some references and look to THET or NHS employers for the benefits to volunteering. Your manager might say, well, what's the benefit to us? Why should we release you for that time? And these organisations can provide good evidence about the skills that you return with and how valuable they are for our NHS service. And something that's difficult to do, I think, while you're in the thick of it, is thinking about recording your experiences. It's quite hard after the event to do that. So as you go along, record what you've learned and what these experiences have meant to you. And there's an example of a toolkit just on the slide there that's been developed by Health Education England, and it can help you with appraisal and other requirements. If you're in training and you're a doctor, you might choose an out-of-programme experience or it's out of programme. And they both have different requirements. And the main advice really would be just to go and talk to your educational supervisor or a Health Education Northwest representative and get some discussions going about how it might work for you within your career. There's also a document, Health Education England Guidance for Trainees Planning to Volunteer or Work Overseas, so you can get some additional information from there. You should think about who's going to support you while you're away. Again, you might be really excited about this opportunity that you have, but it's really important to think about, actually, it can be quite challenging, and who is it that's going to be there for you when you've witnessed something that's been maybe upsetting, and you just need to talk to somebody. So identify somebody in the UK. It could be a family member. It could be someone who's already done some overseas work, so they can understand a bit of the context about what it is that you're going through. And really identifying somebody locally, maybe through your organisation, who can help you maybe put things into context. Sometimes we look at things from only our perspective, and when it can be explained, you can understand the situation a lot better. There are also organisations, MSF, that have online support. There's another organisation called Telemedicine, and if you're a clinical person looking at a difficult clinical condition, you can upload a question and an expert from around the world can provide an answer. And additionally, that provides another opportunity for a volunteering experience. So if you were that expert, you can offer your services to MSF or Telemedicine to be one of those people who comments on a case. Quite importantly, I think Emma's going to probably touch on this, is having a local support network while you're in country is actually quite important, and being open to meeting other people and getting yourself out there is quite important, really. Just some messages about UK professional registration. Those for clinical staff. To remain registered, you still need to meet the normal requirements. So make sure your registration isn't lapsing before you go. Make sure that you've met all the requirements while you're over there. And for getting registration overseas, there are quite a lot of documents that are required, and this can take a really long time. There might be university transcripts of your training that are required. So this is why I say at the very beginning, give yourself a good sort of 6 months to get prepared before you're thinking of going. And it can be really quite expensive. You might have to pay the university for these documents. Often they will ask for a police check. So again, that's another £40, and before you know it, the costs are adding up. You will likely need to apply for a visa. Again, give enough time for that. Very often now you can apply online, but is it something that takes months to get processed, or is it something that takes days? So again, maybe apply early. Quite often, you need about 6 months on your passport, so do check that. You don't want to arrive and you're not allowed in country. And originally or initially, you might start with a tourist visa, but then you might need to get a work permit. So it's getting some advice. You don't want to be in the country without the right documentation and find yourself in some trouble. And it's useful to register possibly with an embassy or a consulate. In Uganda, there's an organisation called UK-Uganda Health Alliance, and they're tremendously helpful to myself and my volunteers, and really supportive in navigating all those kind of issues. Some people don't really think about this, but it's really important if you're undertaking clinical activity that you are covered by insurance. It covers you if you are involved in a clinical incident, but you do need to check, do you have the right level of coverage? It could be that you organise that yourself through a broker, or it could be that it's part of an organisational package. But don't arrive in country having not checked out that information first. It's worth mentioning a little bit about risk. So think about what could be problems. You get that information from the Foreign and Commonwealth Office website. Think about what the weather's going to be like, so what kind of clothing you need to take, food and drinking water, is it safe to drink the water? Public transport, how safe is that and how available? Think about emergencies. What would happen to you if you're involved in an emergency situation? How do you get yourself back to the UK? And again, weigh up sort of clinical risk, that there's lots of things that we take for granted within our NHS, that those systems don't work in different settings or may be different. You need to think about your health. Do you have any long-term health conditions? And think about how would that be managed? Is it easy to get hold of medications? If maybe you lose your medications, are they available in country? How will you access emergency care? Have you got the right vaccinations? And maybe think about taking over a simple kit for first aid. And for clinical work, you should really check out what would happen if, again, you had a needle stick injury. Is there supportive measures there and medication should you require it? It's worth additionally finding out whether you should take out your own personal travel insurance, because an organisation's insurance might not cover you if you do some time-out activities, such as going on a safari. And again, you might need a higher level of cover if you go out for longer, or if the area that you're travelling to is considered high risk. So that's a bit of a whistle-stop tour of things that you need to think about. I'm just going to tell you a little bit now about the Gulu Link. Some of you may have heard of it, some of you may not. Gulu is a town in the north of Uganda. It's a post-conflict region, having had 22 years of civil war. And in 2006, we developed a health partnership between ourselves, the University of Manchester, Gulu University, and the Regional Referral Hospital. And during that time, and to date, we've supported long and short-term volunteers, and that's within clinical service delivery, education, research. We've had people from HR backgrounds, we've had staff from the library. So again, thinking just because, you know, maybe it is that you're a doctor or a nurse or another profession, there are really lots of opportunities that are available to you. What we offer, well, pre-departure preparation and advice. We've got our own specialist insurance in case of a medical or security emergency. We help you with professional body requirements, visa and immunisations, and safe accommodation up in Gulu, transfers. Really, we support your entire journey from the minute you have the idea to the minute that you return to the UK. And what do you return with? Well, quite a lot of people say that they've got better motivation, better communication skills, developed a lot more confidence in themselves, and leadership skills. Really a big appreciation of the NHS that can be difficult when we're having difficult times, and also development of international networks. So hopefully you're now thinking this is something that you might be able to do.